from MD Shishiksha from JGCH, Ayushman Medical College, Hyderabad. Sir is from Karnataka itself, but he is worked in Gujarat and now presently is working in Maharashtra. He has pursued many courses in biostatistics and epidemiology and biomedical research, ethical review of health research, many certificate courses, and he has done, mainly I would like to highlight, he has done the fellowship of advanced medical statistics, which is most useful for you guys for the upcoming future, that is for the PG, where you need research and stats in a higher class, and that will be useful. And he is Google certified educator of level 2, and certificate, he has done many certificate programs on research methodology, biostatistics, with data analysis, which are all important for making us a thesis presentation in PG and in the upcoming future like PhD other courses. So I would welcome you, sir, for this session. And I would like everyone to just attend this session and gain knowledge as per as much as possible. Okay, thank you. And welcome you, sir.
Thank you. Thank you for the nice introduction, ma'am. Good morning, all of you. So first of all, I will congratulate all the students as you cleared your final year BMS exams and you are entering in the internship. As all of you know, the internship is whether my audio is clear? Hello? Audio is clear? Okay. So in the internship program, you are oriented about practical and skill-based approach. In your 4.5 year BMS, you studied theoretical and concept, but now the time for applying the knowledge, whatever you have gained in the BMS. So NCSM as timely regulating the Ayurveda courses, they are updating and to increase the quality of the education, they are doing number of programs and number of updates and some exams also they are conducting for the improve the quality of the graduate. So today's session, I will tell about the important exams after the your BMS graduation. What are the exams you have to take and what are the importance? After that, I will explain the some national initiatives like Ayushman Bharat program. So once again, thankful for the management principal sir of the KTJ Ayurveda Medical College and other staffs organizing committee of this Shishiksha orientation program. So I will thankful to the Dr. Ayushman madam. So now I will start this session. So if any technical problem is there, you can message me. So I will sharing my slide. Is my slide is visible?
Yes, sir.
Okay. So once again, welcome all of you for this orientation program. So now you are entering into the clinical aspect of your undergraduation. So myself, Dr. Ajay Kumar, Assistant Professor, Department of Swastarutta, LRP Ayurveda Medical College, Ishwarpur, Maharashtra. So today I am taking this session about the NCSM exam regulations and the Ayush exams like NTET and next exams. So first of all, the most important exam you have to appear after the completion of your internship is the next, that is National Exit Test. So it is a mandatory licensure examination for BMS BSMS, BUMS graduates under the regulation of 2023 National Examination Regulated drafted by the NCISM. So why this particular next exam has been proposed for the medical graduates? It is for MBBS, BAMS, and even D Pharma students also have to appear the next exam after the completion of their graduation. So this particular examination has been proposed to test the quality or proficiency of graduates, to check the proficiency, the clinical level, understanding level of the subject. They have proposed this national exit test. So after conduction, after the passing of this next exam, you have to practice as a registered ISM medical practitioner. Nowadays, before this next exam, we are, after completing the internship program, we are directly going to the practice. We will take the registration in our state medical registration. But after this application of national exit test, you have to mandatorily pass this particular next exam, and you have to produce the certificate of passing. Then only you have to register in your state or national medical registers, and you have to, it is mandatory to take registration, and for admission of PG courses also it is mandatory. Then only you are eligible to practice as a registered ISM practitioner. So who must appear? So for whom this exam is there, as at the draft 2023 of NCSM, it is mandatory for the after the 20th December 2023. Initially the exam was proposed in the 2024, but most of the students request, they have postponed this national exam test. So eligibility, regarding eligibility, the interns who have completed minimum 270 days of internship before closing day of the application can apply for this particular exam, or the graduates who have completed the 1 year compulsory internship, or some foreign medical graduates recognized under the IMCC Act or NCSM Act, they are also eligible for the national exit test. So if you are doing internship, you have completed 270 days of working days, then also you are eligible, or after the completion of your internship also you are eligible. So before that you cannot apply for the national exit test. So timeline for implementation, from 2023, the NCSM has been telling that we will conduct the next examination. They have notified the next regulation in December 2023. So as per as guidelines issued, the first next exam is tentatively scheduled in the 2024 for trial batch. But what happened in the September 2024, many students are requested to Ayush Ministry that they have to postpone this particular exam, because as it is a new kind of examination, the students are more anxiety. So you have to postpone this exam. So the Ayush Ministry considered this request and postponed the next exam for 2026. So from next year, that is 2026, the next exam will be conducted. They have given they will conduct exam twice in a year, the tentative months like February and August. So from 2026, the exam will be started, next exam. So what is the national exit test exam pattern and format? So based on this NCSM guidelines given in the 2024, so the national exit test will be the multiple choice question. They will give the multiple choice question. Total questions will be 120. Then each question will carry 4 marks. Total marks will 480 marks. And time duration for exam is 180 minutes. Marking scheme, For each correct answer, you will get the correct mark, 4 marks for correct answer. Negative marking for a wrong answer. Each wrong answer you will deduct 1 mark. So medium of exam for Ayurveda graduates, it will be in English and Hindi. For other systems, English and Urdu, Siddha, English and Tamil, as per as their native language, related language to the system. So syllabus based on the NCSM prescribed UG curriculum. So there is no separate syllabus for the next exam, as you already studied NCSM UG curriculum in your BMS, but the assessment will focus on the practical application of your knowledge and clinical scenario based knowledge. Like medical, the questions will be asked to evaluate the competency of the graduate to practice. It is not like some memory based questions, multiple choice question. The questions will be asked like to evaluate your competency to practice, to check your clinical knowledge and application of the theory in the practical field. So that kind of questions will be asked based on the considering the medical ethics, medical legal cases. The questions may be image based, video based, some case based questions also they may ask. So important implications for registration after the completion of your internship. So without passing next examination, you are not eligible to practice and not eligible for the PG admissions. So now degree is not alone sufficient to practice legally. So you have to pass the national exit test for the getting the registration and practice. So what is the passing criteria for next examination? You have to score minimum 50% of the total marks, that is 240 marks for the 480 marks. You have to gain 50% to qualify. They have not given any restriction about attempts, unlimited attempts. You may attend exam as many times. So after successful passing, the next certificate will be given by the NCISM, giving your information, your year, passing year, and your number. And this digitally secured certificate will be valid for your lifetime. So at the time of registration, you have to produce this next passing certificate along with your degree, internship complete certificate, and other mandatory certificates. So as there is no textbooks or no particular materials are available for this national text examination, so many students are asking what are the topics, how questions will ask, what are the textbook suggestions. So as there in market, no specific textbooks are not available, as national exit test is not checking your memory, it is checking your understanding of the subjects and practical orientation based questions. That's why I will show 2 to 3 examples. Based on that, you can prepare for next exam. So it is not a separate preparation for the national exit test. So as you are entering in the internship, so you will be posting in the different clinical subjects, departments. Then, so whatever cases you will observe, whatever theory you have studied in your BMS related to diseases or procedures or preventions or diagnosis, you have to just refresh that concepts and apply in the OPD, and you have to prepare for the national exit test. So some example I will show. So for example, clinical scenario based MCQ. Question may be like this: a 40-year-old man presents with excessive thirst, frequent urination, and weight loss. On examination, his fasting blood sugar is 160 mg/dl deciliter, 160 mg per deciliter. He is overweight and has a family history of Madhumeha. So like this clinical scenario based question, they may ask in the next examination. Here you have to apply your theoretical and practical knowledge for this question, and you have to choose the appropriate answer. So the options are like use of rasayana and vajikarana, brahmana chikitsa and santarpana, or you have to do shodhana therapy followed by shamana chikitsa and use of vatanulomana drugs and snena. So they will give different options, but if you know about clinical aspect of the conditions, then you can easily mark the right answer. So that is, you have to give shodhana therapy, then followed by the shamana chikitsa, as this is the fasting blood sugar is also increased as a pre-diabetic condition, and the predominant symptoms are seeing in this particular patient. So you, as per as Ayurveda concept, you will uh, give the shodhana therapy as in the doshas will explain, and the disease will be cured. So this kind of application you need when solving in the next examination. Then they may ask for the medical legal case questions. For example, a 20-year-old male patient was brought to the emergency room after ingesting a substance at a local farm. He presents with meiosis, bradycardia, and profuse salivation. So you may posted in the emergency ward or any medical emergency department. Then you have to know the most common poisoning in the farmers is organophosphorus. So if you know this kind of things practically, then you may answer this kind of questions more easily. For example, he is a 25-year-old male and he is ingested a substance in a local farm. So most of the time, and he is presenting with the meiosis, bradycardias, all the organophosphorus disease symptoms. So the most appropriate antidote is atropine. So this kind of questions they may ask, and some image based question also they ask. They will provide some images of the drug or any disease condition, and they will ask identify the above condition or above drug. They may ask like this also. They may provide some image and they may ask for this kind of questions. You have to rightly identify the proper dravya or any disease condition or any instrument. They can ask which instrument this is. So that kind of questions are also expected in the next exam. And some ethical related questions may they may ask to know the ethical capability of the students for practice. For example, during the internship, you are in the internship as a student, you are administrating the panchakarma therapy without supervision, without guidance of any supervision of guide or any senior doctor. Then the patient is getting discomfort. So which kind of ethical principle is violated in this particular scenario? Then you have to know the ethical and legal aspect of the practicing also. Then only you can answer for this kind of questions here. So the non-maleficence, that is the harming the patients, you are violating the beneficence of patients. You are harming the patient without a supervision. You are doing a treatment in the internship, and that is leading to the patient discomfort. So this is a non-maleficence kind of violation of the ethical things. So these are the examples. So based on this, you can assume and prepare for your next exam. Day to day, you have to observe your clinical scenarios and what the protocol is there, what are the medicine dosages, what are the advices given by the your teachers in the OPD, and what are the protocols will be followed in the hospital, Ayurveda hospitals, and whatever which department you are posted, what are the protocols for that particular department. So for more updates, you can regularly visit the NCSM website. They are timely, they are providing the guidelines for this next exam, but no exam is conducted till, because the first exam will be proposed in the 2026. So already ministry is giving announcement it will conduct in the 2026. I hope they may conduct some mock test for students to understand the procedure of the national exit test. So it may be conducted as a computer based test rather than offline. I think it will be conducted in the computer-based examination. So these are the some PDFs I have attached here. For more details, you can read these particular documents. So the next second one most important exam is National Teachers Eligibility Test. So when you complete your post graduation, so the NCSM will made mandatory qualification for the appointment of as an assistant professor, associate professor, or a professor in any ISM institution for the first time. So after the post graduation, now you are not directly going for the teaching. So you have to qualify the National Teachers Eligibility Test, as it is a mandatory regulation made by the NCSM. So who should appear for this NTT, or what is the eligibility criteria? So after the completion of your post graduation, you have to apply for this particular National Teachers Eligibility Test if you wish to join the any Ayurveda institution as a assistant professor or associate professor or professor. Or the first time if you want to going for the teaching as a teaching faculty, you have to pass this National Teachers Eligibility Test. Or PG students already completed 30 months of their postgraduate degree, also they are eligible to apply for the NTET examination. Some recognized degrees also given for the eligibility for the NTET exam. For example, all of you know, after the BAMS, MD, MS in the 8th specialization of Ayurveda, you can apply. But as per as this some regulation by NCSM, now NCSM is allowing after the BAMS graduation, the MPH, Master of Public Health graduates, postgraduates also eligible for the NTET exam, and they can also join as an assistant professor in the Ayurveda colleges. For example, after the completion of BAMS, if you are completing Master of Public Health, you can join as a assistant professor in the Department of Swastharutta. But the mandatory thing is you have to qualify the National Teacher Eligibility Test. Then like that, MSc in Anatomy, MSc in Physiology, MSc in Air Biology, these post-graduation holders also eligible to apply National Teacher Eligibility Test. Once they clear this exam, they can join as an assistant professor in the Ayurveda colleges. So what is the exam structure and format? This test is not for checking the theoretical things. This is for checking your teaching aptitude level, postgraduate teaching aptitude level, how you will manage classroom, how you will know the modern techniques of teaching methodologies and student psychologies, understanding the pedagogy and andragogy, and the as per as alignment of National Education Policy 2020. You have to check for that kind of aptitudes in the National Teacher Eligible Test. So the exam type is aptitude based. So then question formats will be MCQ, total marks 100 marks, duration is 120 minutes, medium of exam, the questions will be there in Hindi and English. So marking scheme, 1 mark for correct answer. There is a no negative marking in the NTET. So for qualifying this particular exam, you have to take 50% minimum. That is 50 marks in this particular exam. So initially the NTET has proposed. कौन बात करे 2 मिनट मैडम 2 मिनट मेरा थोड़ा वेबिनार चल रहा है. So frequency and validity, as initially told, there is a NTET has told that there will be yearly 2-time conduction of the NTET examination in the May and December. But for recent brochure I have seen, NTET exam will be held every year in May. The recent exam has undergone 17 July 2025. I think 3 examination has already conducted. 3 batch has already gone for the National Teacher Eligibility Test examination. Here also the unlimited attempts are allowed to qualify, and if if you pass the NTET examination, the certificate is valid for the 10 years. After passing the NTET, you may join a college as an assistant professor or associate professor. Within the 10 years, that certificate is valid for the 10 years. So if you are not joining any institution after the 10 years also, then you have to give the national teacher eligibility test once again. So it will validity for the 10 years. So if you joined any institution, then there is a no need of giving exam after the 10 years. It is only for those who have passed the NTET but not joined any institution. The validity of this particular exam is 10 years. Certificate will be online. E-certificate will be provided with, including all the information, your exam batch, and it will be digital secured. And at the time of joining the institution, you have to provide NTET passing certificate. Then only the NCSM will approve your teaching code, and they will provide the consider the teaching experience. So why NTET matters? So the basic criteria or basic intention of NCSM is, so the faculties there should be competent in the new modern teaching methodologies, and the teaching should be scientific, ethical, and to make the better outcome in the education, they have proposed and conducting this national teacher eligibility test. So syllabus, regarding syllabus, detailed brochure will be there. If you visit national teacher eligibility test for Indian system of medicine and homeopathy, this particular website, so you will get the detailed topics. The topics are like teaching aptitude, classroom management, communication, pedagogy. So related to education and teaching learning method points you will learn. So many textbooks are available. So there is a lot of time to appear this exam for you. As you know, your internship after the completion of post graduation, you will get the more kind of details for this examination. But keep in the mind, these two exams are the most important after the completion of your UG. So one of the exam, Ayurveda post graduation examination is also there. That is not mandatory. Those who are wishing to join post graduation, they have to appear the post graduation examination after completing the BMS. So this is about examinations after the BMS. Now the Ayushman Bharat Digital Mission. So this is one of the initiative uh, initiative done by the Ministry of Health, Government of India. This particular Ayushman Bharat digital mission is a very important aspect for internship students or any practitioners. Why this particular point they have added in the your Shishiksha internship orientation? Because it has practical implication in your practice. So that's why they have mandatory given this particular point in your internship orientation program. So Ayushman Bharat Digital Mission is the initiative of the Government of India. So background of this particular mission is the Ayushman Bharat program initially launched in the 2018. Initially, it was not a digital mission. It is a Ayushman Bharat program launched in the 2018. Ayushman Bharat program was launched for the giving the health care to the Indian system, Indian people, especially for the below poverty people, and equitable, accessible of the healthcare to the everyone. With that kind of vision, they have launched the Ayushman Bharat program in 2021. As all of you know, digitalization and increased technology and internet facilities, everything is nowadays everything is going with online and digital media. So then in 2021, Government of India launched Digital Health ID project, which corresponds to the nationwide rollout of Ayushman Bharat Digital Mission. It is nothing but the Ayushman Bharat program has to be digitalized through digital medium. We have to Okay. So it is a digital kind of version to boost this Ayushman Bharat program. So ABDM Ayushman Bharat Digital Mission is the digital pillar of the Ayushman Bharat, creating unified digital health ecosystem. It is the national initiative to digitalize the healthcare by creating unified digital health ecosystem for the India. This particular mission will connect patients, doctors, hospitals, labs, and pharmacies through digital platforms. So, what are the importance and uses of this particular Ayushman Bharat digital mission? I will explain in later on, but this is the digital pillar of the Ayushman Bharat program. So, all of you know, everyone has the bank account, unique bank account, and Aadhaar card number also. In India, they have proposed, that is in 2021, to provide unique digital health ID for the individual. So this particular ID will be unique for the individual person, and it will be digitally linked with the your health records. So it is a kind of account, health account, where you can find out your all the records and all the past and future records related to health. So then, by using information technology, you can use this particular program for screening, prevention, and management of non-communicable disease and TB and leprosy. See, because lack of operational conditions nowadays, the increased importance of technology, by using this kind of computers, internet, and technology, we can do this some program screening for the certain diseases, or we can give this some uh, arrange, or we can take this some programs or some measures for prevention of certain diseases, and you can effectively control some diseases like tuberculosis and leprosy. Already all of you know the tuberculosis Nikshay app and certain technology based, ITC based mobile apps are helping the patients for the follow-up and proper treatment, and other kind of data is collecting by the government. So the information technology and software digital thing is helping and linking the all kind of programs and health related applications and programs by the providing the unique digital health ID for the individual. So if you check your digital health ID, it have all the history and other documents related to your health. So it will also helpful for the telemedicines. For example, some PSCs, many PSCs, you can now consult the super specialities with PSC by telemedicine, and tele OPD. You can also consult the your OPD by online. At the COVID area, many practitioners or physicians are started to consult online through video call and other particular apps. So this is the main motto for digitalizing the health, telemedicine, and digital linkages of the your health related records. Then Ayushman Bharat has basically two pillars, that is health and wellness centers. Primary centers, basically they have digitalized digital applications as embedded in this particular centers, and another yojana, that is PM Jai, financial protection for secondary and tertiary care. So as all of you know, the below poverty level people will get up to 5 lakh of financial support for their treatment in any government or private hospitals under the PM Jan Arogya Yojana. Financial protection will be there. These two things are there in the Ayushman Bharat. So this Ayushman Bharat digital mission acting as a digital layer for this particular Ayushman Bharat program by providing the digital health IDs, digital records, telemedicine, and IT enabled screening and follow up of the patients. Especially in the tuberculosis like disease, the follow up is very important, because the whether the patient is following or continuously taking the regimen or not. You have to follow that particular patient. Because of now IT enabled applications, it has made very easy for the health workers. They can easily track the patients about regimen and adherent to the treatment. They can easily manage the disease. If the patients are not taking a proper regimen, then it will leads to the resistance of the medicines, and the drug resistant disease will be emerging. So it is most important for following and screening this IBDM acting as a digital layer. So why digitalization is important for the health system? Because there is no common platform, leading the insufficiency, delays, poor accessibility. Many a time the patients will not carry their previous reports. They will not tell their previous history, previous treatment, previous surgeries, or whatever health related issues. But once this digital ID is created, all the health related records, lab investigation, previous history, everything will be available in the at one point of time. Then some key building blocks in the ABDM. So what are the components are there in this Ayushman Bharat digital mission? First one is ABHA, that is Ayushman Bharat health account. So first everyone should create the health account. It is very easy to create health account. You can go to Ayushman Bharat health account. You can Google it. Then based on your Aadhaar card or your driving license, you can create your ID number. Then after OTP will be sending, you will be enter your basic details. Then your unique identity number will be created, and ID card also you can download from the that particular website. Then health facility registry, it is for hospitals, clinics, or diagnostics and labs. It is important for you also, because after the completion of your internship, you may start your own hospitals, clinics, or diagnostic labs, whatever health facility institutions. Then you have to register your clinics or hospitals in the health facility registry. So you have to provide details of your hospitals, which kind of treatments are available, what are the things you are providing, health services you are providing. You can register your health facility mandatorily. Then it will be there in the data, and anyone can see your health facility providing by you. They may approach, or sometimes government also approach you for the some program in the helping in the some programs and other kind of government initiatives related to health. Then healthcare professional registry, what is this? HPR. So after the completion of your BMS, passing the next exam, you will registered in your state ISM state councils. So then you have to apply health professional registry. So you have to give your details and your registration number, state registration number. Then that one will verified, and digitally they will provide one certificate. You are the health professional registered health professional. They will provide one certificate. So it is also visible to the all the people. They can also check your qualification and your health service provided by the your by you, which kind of specialty. It will be there for dental, medical, Ayurveda doctors. Everyone can register for the health professional register. I will show later on how to register and what kind of certificate they will provide. Then health information exchange. So you can by ABDM, the health information exchange will be more easier. Here also the patient autonomy has given most important. Without consent of patient, the records will not be shared. Records will be shared only with the patient consent, because without consent, if we are sharing the data related to patient, that is the violation of the privacy. So here also the consent based sharing of the data is there. Then unified health interface. Because of this, you can uniformly give the health services. So that's why it will connect the patients and providers, that is health providers, doctors, lab workers and specialists by telemedicine, e-Sanjeevani app, and e-prescription and certain lab tests. So this is a kind of UPI. As you have, if you have a UPI number, you can do this transaction any bank or any branch or anywhere. So like that, if you have unified health interface, then it is more easier for the providing the health system. So in simple, the manner how this ABDM works, patient will create a ABA number, then they will visit hospitals. In hospitals, many a times you will see the longer queues to take the appointment or numbers, OPD numbers. Nowadays, what they are doing, they are sticking the QR codes in the hospitals. So if you have a ABA number and ABA application, then simply you have to scan that particular scanner and automatically your details will be there, and based on your history, your clinical symptom, they will allotted particular department, then the token will be generated and you will consult directly to the doctors. There is a avoiding of long physical queues also possible with the this particular Ayushman Bharat digital mission. And digitally you can also consult the doctors, and your records will be shared with any doctor and lab and insurance. Some in health insurance, you may claim the health insurance for your treatment, then also the records can be digitally shared with your consent. So what are the benefits for this Ayushman Bharat digital mission is for patients, how it is helping for the patient. The patients need not to carry files. So this is the biggest burden in the hospitals. Many a times patient will not take the previous documents, then it may leads to the repetition of investigations or repetition of taking histories and other kind of things. So by this digitalization, so everything is available as online, so no need to carry files, and safe and consent based sharing of the records. If any doctor wants to share his files and documents for another specialized person or for lab, then taking consent and sharing the records safely is also possible. It is a good thing for the patient. The patient need not to take the files and giving showing the other super specialized person or lab. The online transfer is easy for the patient. It will benefit and it will reduce for the burden of carrying the files. And easier teleconsultation for remote area. If you want to consult any specialist, then also it is possible because of the digital apps application. So the patient need not to go for higher centers for follow-up and other kind of health related issues. Then access to health all records on the phone, in your mobile phone only. If you download the application, if you have the number, then you can access all the records in your phone. For providers, how it is benefited for health providers, for doctors, hospitals, labs, how it is helpful, because it is a verified digital presence, HPR. Once you registered in the health professional registry, you are verified health provider. So that gives the more verification, and you have the essential qualifications and verified things in your profile. Then faster access to patient history and reduces the paperwork. Many times you need not to do the paperwork, and it will improve the efficiency by reducing the manual work as everything is available online. For system, the whole health system will be get fastened because of the digitalization of the health. So lack of communication, delay in the protocols will be reduced because of the availability on timely on the online. So the health system is also improve their better planning and decision making. So one thing, Ayushman card and ABA card, there is a difference between these two cards. ABA health card is for all the individuals. They can create their ABA card. But this Ayushman health card for the eligible candidates are below poverty level. They can get this particular Ayushman health card. They can take the treatment up to 5 lakh. in any government or private hospitals. But ABBA card is universal. All of anyone can create the ABBA health card. But for Ayushman health card, there is a certain criteria of getting the Ayushman health card based on their income, source of income, and other kind of criteria are there for the Ayushman health card. So this is the portal of the government website, abdm.government.in. If you go through this particular website, you can create your ABBA number using your Aadhaar card, or you can use your driving license also. Simply you have to give information related your name and everything. Then OTP based consent will be there. Then you can easily create your ABBA card. Then free online consultations are also made through eSanjeevani, like particular applications are there. Android, you can go to the Android Play Store and or Apple phone, you can download eSanjeevani. You can also consult or provide the OPD services online to the patients. So this is digital app for digital Ayushman Bharat mission. You can go to the Play Store and you can download this particular app, and here you can log in as a patient or doctor. So the patients can log in as a patient and they can give the appropriate information, what are the problems and which kind of problems they have. Based on that, the app will suggest and availability of the doctor. The patient can consult doctors through online video call. So like Ministry of Health, Ayurveda, also Ayush Ministry has also launched many applications for the digitalization of health. So these are the some important applications like Ayush Sanjeevani. So e-Sanjeevani is for Ministry of Health, that is general one for consultation, but Ayush Sanjeevani is for Ayurveda, Ayush treatment, OPD consultation. Ayush Sanjeevani is launched by the Ministry of Ayush. So like this, many other apps, WHO Yum Yoga, Vibrate, Echaraka, Namaste Yoga. So these applications are developed by the Ministry of Ayush to promote the Ayurveda in the globally, and also for reaching the Ayurveda treatment to each and everyone. So all of you should aware this kind of applications, and you have to install these applications and start using these applications. And many a times in your next examination or post graduation also, they may ask this kind of questions: what are the digital initiatives started by the Ministry of Ayush? They may give these four options: eSanjeevani, Ayush Sanjeevani. So like that kind of option. Then if you know the updates like this, you can easily mark the digital initiative Ministry of Ayush is Ayush Sanjeevani. So these are important for your practice also and your next upcoming examination also. So these are the other applications. They will work with the integration of this ABDM. Even though these are private applications, they can work with the ABDM, Ayushman Bharat Health Account. So apps related to people, that is citizens, they are ABBA Health Locker, eSanjeevani application, and UHI based telecommunications applications are there for people, those who want to consult online. These are the citizen applications. Provider facing application, we have health professional registry, HFR health facility registry, and hospital integrated management system or lab integrated management system. In the hospital, there is a specific software or applications you have to installed. The everything will be done through this particular HIMS application. In Ayurveda, Ayush has given HAMS, Ayurveda Hospital Integrated Management System software. They will advise all the Ayurveda hospitals should have this particular software. So after completion of your internship, once you get the registration, you have to register National Healthcare Provider Registry. So simply you have to go through this particular website and So all the health system like modern medicine, dentist, Ayurveda, Unani, homeopathy or nurses are also eligible to register themselves in this particular national health provider registry. So this is the dashboard. So after filling, you can see this kind of things, whatever information you have provided. Now it is verified and they will consider you are a registered fair professional, registered under the health professional that will run by the National Health Authority. So this kind of certificate, digital certificate, they will provide. As you can see here, healthcare professional ID, they will provide this particular ID. This particular ID is needed for when you are registering your clinic under the KPME Act or any particular legalization. If you are registering your clinics, hospital or health services, you need this healthcare professional ID number. And by providing your state registration number, that will also reflect in your particular health HPR certificate. So you can utilize this for telemedicine, teleconsultation, teleprescription, as you are a verified digital doctor. So this is the benefit for the health professionals under the scheme of Ayushman Bharat digital scheme. I hope the basic information you understood about this particular initiation by Government of India Ayush Bharat digital mission. Now, if you have any doubt or any clarification, please unmute yourself. Unmute. Okay.
So no doubts as per our students.
Okay. I hope
Let's see when they appear for the exams.
I hope there is no doubts, as national exit test is also not conducted till. So you can go through your clinics and focus on the clinical aspect. Then it is more easier for the next examination. Then once again, I will thankful for the organizers, the principal of the KTJ Ayurveda Medical College, staff and management and students, those who are listening this particular session. And I will special thanks to the Dr. Aishma madam for providing this opportunity. I will thankful to the whole management and staff for once again for this opportunity. I hope the session was made clear to the students. Thank you once again. Thank you all of you.
Thank you, sir. As the quote says, distance does not matter when you are curious enough to learn and gain knowledge. Technology will never replace great teachers, but technology in the hands of great teachers is transformation. As we had asked Sir to be here with us physically, but due to our hectic schedules from NCISM, it was not possible for him. But he has taken his own, he has spared his own valuable time for us, and he shared our knowledge with us. Your willingness to share your knowledge made a big difference. I feel because Indians still new to such exams, know little. Now with your insights, they have gained much of the information. Thank you, sir, for your sharing your valuable knowledge and insights. Your informative and engaging session was truly enriching and greatly appreciated. We sincerely appreciate your time, expertise, and the effort you put into guiding our interns and the faculties also. Thank you for being an exceptional resource person who sparing your precious time contributing value addition in our interns' future life. We shall be happy to receive the physical in future for further such informative session and also online coaching for the growth of our budding doctors. I would like to share one more thing. Sir is a very practitioner in our area. He used to practice earlier. He never used to go home for having food or sleep. That much busy he was, just doing the behaviors. Think about PG, yeah? Doing PG. People still remember him whenever he visits are negative. People coming to him. It's like we have so many doctors, but we don't go to him. They go to Dr. Ayushman, sir. That's practitioner release. Since with that also, if I start sharing his examples, his practice, the day will not be enough to just tell regarding him. He is a eminent practitioner, and now with that, same I thought he will continue the practice itself, but he has joined so many colleges. He changed. He was in Gujarat, he learned many things from there. Now he's practicing in Maharashtra, in LRP, Ayurvedic Medical College, which is Islamabad. And you guys take PG admission, definitely will be helpful for you all. He takes coaching examinations for NTET and NTET also. So it will be helpful for you guys. Thank you, sir. Thank you once again.
Thank you, ma'am. Thank you. So,
Thank you, sir.